what is actually a robotic surgery?
Robotic surgery per se is not a robot doing the surgery. To be more precise, it is robotic assisted laparoscopic or a minimal access surgery.
So we at Tanuvu celebrate human body as an amazing marvel which God has gifted us. We believe it's a greatest engineering marvel that has ever existed.
One becomes a true surgeon after he starts exploring and enjoying his surgery rather than reading in the textbooks and just opening up somebody's abdomen.
Telesurgery. It has become very popular nowadays.
Through the robo, through the internet, to a server, from there routed to Wuhan or wherever the surgeon is stationed, then into his console. He has to see it and he has to move his hand.
Coming to the surgery for which you have become a social media sensation. Hello Smart Sapiens, welcome to Tanuvu, where we turn the marvels of human body into information you can grasp. Every innovation we discuss here is a step towards making the invisible visible. Today we have with us Dr. Ghouse. He is the Chief of Robotic Surgery at Asian Institute of Nephrology and Urology, and he is with us today to unravel the mysteries of robotic surgery. He has been a social media sensation these days because of the tele-robotic surgery, the first Indian to transcontinental tele-robotic surgery from Wuhan, China to India, nearly 3,900 kilometers. So that's what we are going to discuss and understand today. So welcome to our episode, Dr. Ghouse.
Thank you all the viewers, and thank you Dr. Srikanth for this opportunity.
He has been my friend, colleague and an associate for nearly 10 years now. So I'm happy to have him here on our episode. So without wasting much time, we'll go into the first discussion of today's. Let's straight away jump into level 0 question. My aunt, very well read, she believes robotic surgery means something like a Terminator is doing the surgery. What is actually a robotic surgery?
Yeah, basically, robotic surgery per se is not a robot doing the surgery. To be more precise, it is robotic assisted laparoscopic or a minimal access surgery. The actual terminology is that. So what exactly is robotic surgery if you ask me? It is basically a surgeon who sits on a console, gets assisted by a robo to do the same surgery which he was doing all these years by the open technique or the laparoscopic technique. But here with lot of precision, with minimal access or minimal damage to the tissues, with more tremor free hand movements, and with lot of magnification in a 3D high definition vision, and you can reach in deep corners of the abdomen which were not possible if you would have done in a open surgery.
So we'll break that down in simple words. And the first thing that caught my attention was you said you are working on a console. Console అనగానే అదేదో అంటే ఈరోజు యూత్ యూజ్ చేసే గేమింగ్ కన్సోల్ లాగా సౌండ్ అవుతుంది. Would that feeling be similar to playing a video game?
Absolutely. It is basically nothing but an electronic media or a console where you manage or you manipulate something else. Console is nothing but the controls of something else that you are managing. So even robo has a console that is known as a surgeon's console, not a gaming console but a surgeon's console, where a surgeon sits, has his 3-dimensional high definition vision to his eyes. You put your head into the console, you put your fingers into the controls of the arms where you move all the robotic arms which are attached to the patient.
Stakes here are life versus death of a person who is on the table. The second thing that caught my attention when you talked about the surgery is that you will be sitting away from the patient on a console. సో ట్రెడిషనల్గా సర్జరీ అనగానే సర్జన్ వాష్ అయిపోయి గ్లవ్స్ వేసుకొని అలా ప్రిపేర్ అయ్యి సర్జరీకి వెళ్తారు. సో హౌ డు యూ డూ అన్ యాక్చువల్ రోబోటిక్ సర్జరీ అంటే యాక్చువల్గా ఆన్ టేబుల్ ఏమవుతుంది?
టు బ్రేక్ ఇట్ డౌన్ ఫర్దర్, ఎనీ robotic surgery has 3 components of a robo itself. One is the patient cart or the equipment which fixes to the patient itself. That is, patient is anesthetized, put into a proper position depending on which organ you are operating, and then the patient cart is brought near the patient and ports are placed. Small tiny holes less than a centimeter are made onto the abdomen and ports are introduced. Now ports are nothing but holes through which the robotic instruments enter inside the abdomen. Then the robotic cart or the patient cart is brought near, and these ports are a dock. Docking is nothing but attaching the robotic arms to these ports. That is known as docking. So this docking and port placement happens probably in 2 to 5 minutes of the initial procedure of any robotic surgery, and once this is done, you attach the instruments to the abdomen. Now you come to the surgeon's console. So surgeon's console is the second component. The third component is a processing tower, wherein all these movements in the console are transmitted to the patient cart. All the images that we see are transmitted to the image cart, which can be used for recording, which can be used for transmitting across continents or different cities. So the image cart, patient cart and surgeon console are the three components of any robotic surgery.
యు ఆర్ నాట్ స్టెరైల్, అక్కడ మీరు చేతులు ఫ్రీగా పెట్టుకొని గేమింగ్ కన్సోల్.
Absolutely.
ఓకే ఓకే, దట్ సౌండ్స్ వెరీ ఇంట్రెస్టింగ్.
Robotic surgery, again it's of two types. Single port surgery, wherein a single port is made and it opens up inside the abdomen into multiple arms which operate, or a multi-port surgery which is traditionally available throughout the world. Single port surgery is not yet still into the mainstream. Multi-port surgery, multiple ports are placed. One of the port is a camera port. So that gives a vision inside the abdomen, which is actually created by creating a pneumoperitoneum. Pneumoperitoneum is nothing but filling the abdominal cavity with a carbon dioxide, which is a inert gas, doesn't inflame when you are doing a cautery or using a current inside the abdomen. So you fill the abdomen with a carbon dioxide, put in these ports. One of them is the camera port, which is a binocular camera port. Binocular in the sense, rendu kannulto chustene depth ardhamaitadi. If we close one of our eye, the depth perception is lost. So if you are driving and you have one of the eye closed, you will not know how far the next person is while you are driving. Only when you have got two eyes open that the depth perception comes. So this binocular, rendu kannulto chuse camera anedi is required for having the depth perception, which is there in this robotic system.
ఓకే, సో మీరు కూడా ఆ రోబోటిక్ కన్సోల్లో బోత్ ఐస్ విజన్ చూస్తుంటే ఇట్స్ యాక్చువల్లీ లుకింగ్, అంటే మామూలు ఓపెన్ సర్జరీ కంటే బెటర్ విజన్ ఉంటుందా?
Definitely, because open vision you have a 6x6 acuity, you see what is there traditionally, but here it's a magnification, almost sometimes 10 times magnification, and that magnification also you can further zoom optically or electronically onto the console. So it is basically zooming up, like how you use your Google Maps, you zoom up into the place where you are interested. So that can be done on a console, see a particular area with a more magnification in a 3D vision.
So we at Tanuvu celebrate human body as an amazing marvel which God has gifted us. We believe it's a greatest engineering marvel that has ever existed. As a surgeon, when you look through the eyes of a robot, when you have a more closer view than what human eye can actually see, do you agree with our theme or our principle?
I 100% agree with your theme that a human body is vast encyclopedia of so many things, complex things happening without our knowledge. So basically robotic actually opens up much more avenues in a more magnified view to appreciate all these things which are there inside the human body. And once you start seeing the planes, once you start seeing the tissue textures inside the abdomen, how every organ is packed in a natural embryologically developed membranes, these are known as planes, and these are the planes where a surgeon explores. So supposing one needs to go into the posterior compartment of the abdomen wherein our work is there. So that is a place where
abdominal organs
venakala undedi
unde tissues,
the intestine and all are intra-abdominal contents wherein they are covered with a membrane, and this membrane again reflects back onto the anterior abdominal wall. Few contents are there inside this cavity, few contents are there behind this membrane, which is known as a peritoneal covering. So these membranes actually are lubricating membranes which prevent friction between the organs when they are moving inside.
Okay, I envy the surgeons for having such a closer look of organs inside the body. As physicians, మేము పొద్దున్న లేస్తే ఇది అది అని ఊహించుకోవటం తప్ప actually seeing inside the human body is amazing experience, I believe.
One becomes a true surgeon after he starts exploring and enjoying his surgery rather than reading in the textbooks and just opening up somebody's abdomen.
But it is very interesting when you told ఏదో భగవంతుడు మనకి సూట్ కేసులో బట్టలు సర్దేసినట్టు అబ్డమిన్ అంతా నీట్గా ఆర్గన్స్ని ప్యాక్ చేసి కవరింగ్ ఈచ్ లేయర్ బై ప్రొటెక్టివ్ కవరింగ్, making sure that there is no friction between these organs when they move. It's just such a complex, very interesting. Now, the other thing that caught my attention when you told about the robotic surgery is you told about tremor minimization. అసలు ఆ ట్రెమర్స్ అంటే ఇప్పుడు మనం సర్జరీ ఏ సర్జన్ కన్నా, న్యూ సర్జన్, ఓల్డ్ సర్జన్, హూఎవర్, వెనెవర్ యు ఆర్ ఆపరేటింగ్ హ్యాండ్స్లో ట్రెమర్ వస్తుంది. సో మెషిన్ వాట్ డస్ ఇట్ డూ టు minimize that, and is this the core advantage of a robotic surgery?
One of the major advantage which a surgeon has, patient has many advantages of robotic technology, but surgeon also has a few advantages. Like surgery, as you have seen, it comes with experience, and as the surgeon grows old, he is more experienced. That is where the skill improves. That is where the skill has matured. But that is also the time where the surgeon develops a bit of tremor. So that tremor is nullified at the console level itself. So these tremors are not transmitted to the patient cart and into the instruments that you are using. So that tremor nullification, suppose you have a good cup of a coffee, even a normal person can have a bit of tremor.
Correct.
Which is not transmitted in robotic surgery.
సో ఈ ఫర్ ద సేక్ ఆఫ్ ఆడియన్స్ ఇప్పుడు రేపు నాకు ఏదో సర్జరీ అవసరం పడింది, గాడ్ ఫార్బిడ్ వీ డోంట్ వాంట్ టు గో త్రూ ద సర్జన్స్ హ్యాండ్స్, బట్ ఇఫ్ ఐ నీడ్ ఎ సర్జరీ టుమారో, టెల్ మీ 3 reasons why I should consider robotic surgery. How is it superior to a traditional surgery?
See, we don't wish any of the persons to go for surgery, but God forbid if somebody requires, we should offer him the best possible way for advantages for the patient as well as to the person who is operating. So it's a win-win situation when you go for a robotic surgery, for the surgeon, for the patient. For the patient, what are all the advantages? The first thing is you will not have a traditional long incision to reach the area of interest. Supposing a deep in the pelvis surgery is required, wherein you just to view that area you need to have a big cut because our optics don't take turns.
Correct.
We need to have a straight vision to the area where we are interested in. So we need to expose the abdomen in such a way so that that area is clearly visible. Second thing is our hand movements. Every human has a particular level of degree of movement beyond which one cannot move the hand. Pronation, supination, that is movement of a hand medially or laterally, is all restricted at a particular angle. Beyond that one cannot do. But the robo which is known as endo-wristing movement. So this endo-wrist, what it does is it mechanically rotates almost 540 degrees in either of the directions. So this sort of movement helps in taking delicate sutures, difficult situations, holding the needle at different angles. All this thing is possible because of this endo-wristed movements and this ports being placed from far away.
Okay.
This is one advantage to the surgeon. Now coming to one more advantage to the patient. Just because the incisions are not big, the pain which the patient faces is hardly anything. It is like a small less than 1 centimeter stab incisions that we make onto the abdomen for these instruments to enter inside the abdomen. Imagine having a large cut on your toe versus a small nail getting pricked. You just remove the nail, you don't have further any pain. It's as simple as that. So you remove the ports, the pain is gone. But still you will require a bit of analgesia that will be given in the hospital. But versus having a big incision that requires lot of suturing, and these sutures they get infected, they need to be taken care of, and the patient is on the bed for almost 15 days, 20 days, sometimes a month or so for these big incisions to heal. Here patient is up and about in the next day. We start feeding him in the next day, and then the other day we discharge him also.
So smaller incisions, faster recovery times,
Yes.
and minimal risk of infection. So
Correct.
3 main advantages which we can say about robotic surgery.
Absolutely. And to the surgeon, sit at your console comfortably, don't sweat at the patient's side, need not have a retraction by other assisting doctors. Just sit at your place and happily do the procedure without yourself getting tired.
The robotic hand you said is superior because it has easy maneuverability, and a nook and corner of the body it can reach. How do you feel as a surgeon with so many years of experience, and now suddenly the robotic hands are superior to the hand movements of a surgeon?
It is like adding an extra feature to whatever you already have. An additional feature which enables you to do few more things better. Simple example is you have got a camera which has got multiple zoom lenses, and you give a zoom lens with which you can see Eiffel Tower which is far away with lot of clarity, and you can see who is standing on the tip of the Eiffel Tower, standing on the ground itself.
So the camera, the sensor is the surgeon,
Yes.
but the extra
lens.
extra length that the arm is able to go in is compared to a
That is the zoom lens which is given.
ఓకే. అన్ని సర్జరీస్కి రోబోట్ని యూస్ చేయొచ్చా? రోబో ఈజ్ ఇట్ అడ్వాంటేజ్ ఫర్ ఎవ్రీ సర్జరీ, ఆర్ దానికి ఏమైనా లిమిటేషన్స్ ఉన్నాయా? కొన్ని సర్జరీస్లో ఇట్ మే నాట్ బి అ రైట్ చాయిస్ అనే సిచ్యువేషన్ ఏమన్నా ఉందా?
See, robotic surgery is a tool in a surgeon's hand to decide wisely as to which surgery what he is supposed to use. It is like giving an example of having a Rolls Royce or a Porsche car in your garage, and you go just to a supermarket which is just walkable distance from your house in your Rolls Royce just to buy some groceries.
That doesn't make sense.
That doesn't make sense. So you need to have indications, you need to have specific situations where there is a lot of complexity, there is a lot of stake that is involved, and it's a difficult situation wherein open surgery or a traditional surgery is not that superior to doing a robotic surgery. Only then when you weigh in the amount of effort required versus the advantages, that is when the robotic surgery needs to be used, and it is a wise decision of the surgeons to decide whether robotic surgery is supposed to be used or not.
Telesurgery, it has become very popular nowadays. అంటే టెలిసర్జరీ అనగానే ఎక్కడో వేరే సిటీలో ఉన్న సర్జన్ ఈజ్ ఆపరేటింగ్ ఇన్ ఎ రూరల్ ఏరియా, దట్స్ వాట్ ఈస్ పర్సీవ్డ్. నౌ దెర్ ఇస్ ఎ లాట్ ఆఫ్ స్కిల్ గ్యాప్ ఇన్ ద వరల్డ్, స్కిల్ గ్యాప్ ఇన్ ఇండియా, వేర్ ది ఎక్స్పర్టైజ్ ఆఫ్ ఎ సర్జన్ ఈజ్ నాట్ అవైలబుల్. డూ యూ సీ ఎ ఫ్యూచర్ where surgeons are operating from the central areas and lot of patients are getting benefited by undergoing the surgery in a rural area? రూరల్ ఏరియాస్లో ఇంత సర్జన్స్ వెళ్ళి పర్ఫామ్ చేయడం పాసిబిలిటీ లేనప్పుడు మీరు చెప్పినట్టు ఆ 3 partsలో ఐ బిలీవ్ దట్ ది పేషెంట్ కార్ట్ ఈజ్ ప్లేస్డ్ అండ్ ద పేషెంట్ అండర్గోస్ సర్జరీ దేర్ while the surgeon is doing it from a high end place in a city or something else. And do you see a future where the telesurgery fills the gap of medical care in India?
It is very too early to have this talk about doing telesurgery in India itself, but if the infrastructure is available, if the entire robotic system, not only the patient cart, the entire robotic system needs to be available with the patient. The surgeon's console can be anywhere, but there should be a surgeon console with the patient also, because given a situation when the telesurgery connectivity is not there, there should be a local surgical team which should be able to take over and do the procedure. So the entire surgical robot system with all the 3 components needs to be there at the patient level, but the surgeon's console, one more surgeon console rather, can be there anywhere in the world, and you need to have a very good connectivity. Just having it without a good connectivity again doesn't serve the purpose.
Yeah. Coming to the surgery for which you have become a social media sensation. So Wuhan to Hyderabad.
Yes.
So that is what is the surgery, and what is the actual surgery that you have done?
So I had done a ureteric reimplantation, wherein a ureter which was blocked was reimplanted onto the bladder in a new fashion to bypass the obstruction.
అంటే యూరిటర్ బ్లాక్ అయిందని మీరు కట్ చేసి బ్లాడర్కి యూ ఆర్ ఏబుల్ టు అటాచ్ ఇట్ బై క్రియేటింగ్ సమ్ ఎక్స్టెన్షన్.
కరెక్ట్.
ఓకే. సో ఈ లేటెన్సీ అని మాట్లాడారు, యూ టోల్డ్ సంథింగ్. సో వాట్ ఈస్ దట్? కెన్ యూ ఎక్స్ప్లెయిన్ ఇట్ ఇన్ లిటిల్ మోర్ డీటెయిల్? అంటే ఈ లేటెన్సీ అనేది, is it a problem in robotic surgery? Is it the major gap in this kind of surgeries?
So if you want to describe the entire pathway of telesurgery, basically the optic impulses or the optics which is taken from the patient's abdomen has to travel through the robo, through the internet to a server, from there routed to Wuhan or wherever the surgeon is stationed, then into his console. He has to see it and he has to move his hand to do a surgery. Again, his hand movements have to go back through the entire route back to the patient, and the arms have to move. So all this process, however fast it is, depends on the network connectivity between these 2 points. So there is a bit of lag, though the lag is in a fraction of a millisecond.
Fraction of a
millisecond. If you break a second into 1000 pieces, and if the 1/50th or 200th of a millisecond gap is there, that is considered to be not significant. If it crosses 200, that becomes significant.
అంటే మీరు చెప్పేది, ఫర్ మీ ఇట్ లుక్స్ లైక్ ద హ్యూమన్ లేటెన్సీ ఇన్ అండర్స్టాండింగ్ ద ప్రాబ్లమ్ అండ్ యాక్టింగ్ ఈజ్ మచ్ హయ్యర్ దెన్ దిస్ network and this logistic issues.
Absolutely. So even if it crosses 200 milliseconds, that is when you start appreciating the gap of movement, whether what you are doing and what is happening there. So that you start appreciating. Like if you start appreciating a high definition TV, if 4K is there, 8K is there, 12K is there, the difference will not be much. High definition is what our eyes can see. If any other further resolution enhancement is there, though if you keep it comparatively you can appreciate, but if you keep it natively you will not be able to appreciate it different from a full high definition. So that's what happens here. If the latency is more than this threshold, then you start seeing the difference between your hand movements versus what is happening in the patient's abdomen.
Correct.
So that latency is a technological thing, and with the availability of the 5G networks and with the availability of high broadband speeds, this has been brought very close to as good as having less than 40-50 milliseconds gap.
Financial aspect of it. ఈ రోబోటిక్ సర్జరీస్ ఐ బిలీవ్ విల్ బీ మోర్ కాస్ట్లీ, అంటే మేబీ 3 to 5 times more expensive than a traditional surgery, I believe. There will be a lot of consumables అవన్నీ ఉంటాయి. సో ఈ కాస్ట్ అనేది, డూ యూ థింక్ ఇట్స్ ఎ మేజర్ హిల్?
Because there are not many robots available in the market, and because of the amount of throwaways or the amount of non-reusable items that are used in a robo, because instruments are single use, they have a limited lifespan, beyond which, supposing for example 5-6 users or 10 users, you need to take a different instrument. You need to have drapes or the sterile gowns onto the robo, which are again single use, and the initial cost of owning a robo also is quite huge. It goes into the tunes of tens of crores. So this initial cost plus per case cost adds to the cost of the surgery itself, which needs to be transmitted to the patient. So going forward, probably because the competition increases, more and more robots are coming into the market, the cost per surgery might go down, because the initial cost will go down and the reusability of the instruments and this disposables will go down over a period of time. That is when probably it will come in the mainstream, and every nook and corner you can have robotic surgery done comfortably.
ఓకే, సో బిఫోర్ వి క్లోజ్ ద సెషన్, వన్ ఫైనల్, అంటే మా ఆడియన్స్లో ఉండే సర్జన్స్కి కానీ బడ్డింగ్ డాక్టర్స్ హూ వాంట్ టు టేకప్ సర్జరీ యాజ్ దేర్ బ్రాంచ్, యాజ్ ఎ సర్జన్, వాట్ ఈజ్ యువర్ మెసేజ్ టు దెమ్ అబౌట్ ద future of robotics or future of this kind of innovations in surgery?
So to all the budding doctors and surgeons who are aspiring to become good robotic surgeon in future, I would say we are at the pinnacle of surgical innovation, and probably we will look back to these ages probably in the next coming 15 to 20 years, saying that like how we look back to our ancestors who were doing surgical interventions without anesthesia or with ether or with just a mask, and local anesthesia when it was developed, bacterial antisepsis when it was developed, like how we look back to those innovations, probably 15-20 years or 20-30 years from now, people operating in those era might look back to this century, saying that what innovations they were doing, where they have landed up. And I think the future is alarmingly good, and you will enjoy doing this robotic surgery. There are much more avenues that can come. There are much more developments in the technology that will happen. Telesurgery probably will become more day-to-day business. There will be better connectivity. Probably going down in the line of robotic, it's going to be a very marvelous future, and all the best to all of you.
So robot is brilliant, 5G is fast, surgeon is amazing, but everything around is built to take care of the man on the table. We believe the most exciting and the most important person in the room is still the patient. So with this closing words, we end this session. Thank you for being with us.
Thank you, Dr. Srikanth, for giving this opportunity, and I also appreciate your efforts in putting up this podcast or this sort of a learning experience for the budding doctors, wherein you explore the body with marvels inside, how they are working, and making it lucid so that everybody understands it comfortably. So I would appreciate this effort from your side, and I thank you for this opportunity. With Tanuvu, discover the marvels within.